Hello, my name is Dr. Anzhela and I'm internal medicine doctor in International Medical Center. And today we want to discuss the impact of the coronavirus pandemic and what we can do to minimize complications from this illness, but also how to maximize your health in case you get exposed. The good news is that the most cases of coronavirus are mild. The more severe and deadly cases are usually those with pre-existing medical conditions and poor immune function. As awareness of the new coronavirus spreads, there has been a lot of fear and panic, mostly due to misinformation. The best way to fight fear is with facts. Let's be proactive and not panic. COVID-19 is a respiratory disease first identified in Wuhan, Hubei province, China in December 2019. It comes from the 2019 novel coronavirus called SARS-CoV-2. The coronavirus is spread via respiratory droplets, small droplets of mucus or saliva carried through the air when an infected person coughs or sneezes. Those droplets can travel approximately 6 feet. You can become exposed to the droplets by breathing them in, direct contact, getting coughed on, or by shaking hands with or sharing a drink with someone who's infected. Hand washing with soap and water for at least 20 seconds is one of the most important precautions you can take to minimize the risk of getting the coronavirus. The most common symptoms are fever, cough, and difficulty breathing, similar to what you may feel with influenza or a bad cold. Some people have had nausea, vomiting, or diarrhea before the onset of respiratory symptoms, but this has been uncommon. Some people with the virus may have no symptoms at all, be asymptomatic. Many people have mild to moderate symptoms. Some people develop pneumonia and severe respiratory distress. This can be life-threatening, leading to death. Based on CDC guidelines, it is not recommended that the general public wear face masks. If you are sick or have a cough and have been potentially exposed to the coronavirus, you should wear a mask and avoid coming in contact with other people as much as possible. If you are a healthcare worker caring for patients who have or potentially have the coronavirus, you should wear an appropriately fit mask. There are top 3 tips to avoid getting the coronavirus. The first one is to wash your hands often with soap and water for at least 20 seconds. Coronavirus is spread through respiratory droplets generated through coughing, sneezing, or contact directly with mucous membranes, such as the eyes, nose, or mouth. Regularly wash your hands with soap and water for at least 20 seconds. If no soap is available, use an alcohol-based hand sanitizer. The second tip is avoid close contact with people who are sick. If you are feeling sick or have a cough, stay at home. If you work in a large office setting, see if you can work from home. If you have a cough, wear a mask and stay at home as much as possible. If you are over 60 or have pre-existing medical conditions such as asthma, diabetes, or heart disease, you might want to minimize your contact with a large group gatherings as precaution. Third tip is avoid touching your eyes, nose, and mouth with unwashed hands. The virus can be spread by contact with a surface that has had contact with respiratory droplets, like your hands. If you cough, do so into the crook of your elbow, not your hands. If you cough into your hands, immediately wash your hands. Unless you have moderate or severe difficulty breathing, stay home. and call your doctor or local polyclinic. Depending upon your symptoms, you may be recommended to stay home and self-quarantine or go to one of the coronavirus testing centers in Almaty. Staying out of the doctor's office will minimize the risk to others if you do have a coronavirus. With the rapid spread of the coronavirus, medical systems are in the danger of being overwhelmed and increasing the spread of the virus. Do everyone a favor and call ahead. To help prevent spread of the coronavirus, our physicians can do online consultations, where we can assess your situation in the comfort of your home or office. Please call our office and we would be happy to arrange this service for you.